Dear doctors, in the modern era, the pathologist is no longer just the doctor's doctor. We are the pilots of the oncology team. Without our molecular profile, the oncologist cannot choose the drug and the surgeon cannot choose the scope. Part 9. Lab Diagnosis. The Pathologist's Toolkit. First one in the lab diagnosis techniques are FNAC, the fine needle aspiration cytology. It is quick, cheap, but you lose the architecture of the tissue. Biopsy or histopathology. It is the gold standard for diagnosing any cancer. IHC or immunohistochemistry. We use label antibodies to find the tumor's origin. For example, if the IHC is cytokeratin positive, it points towards carcinoma, whereas vimentin positive points towards sarcoma. Just remember this rule. Next we'll see IHC panel approach. You don't just give one marker, you think in panels. For undifferentiated round blue cell tumor, you look for CD45, for lymphoma CD99, for Ewing sarcoma, desmin, for rhabdomyosarcoma, and synaptophysin for neuroblastoma. Tumor markers, you check these in the blood. For prostatic cancer, you check PSA. For colon and pancreatic cancer, you check CEA. For liver cancer or yolk sac tumor, you see AFP. For ovarian cancer, you see CA125. And for medullary thyroid cancer, you see calcitonin. Advanced diagnostic pathology. Molecular diagnostics. FISH, fluorescence in situ hybridization. We look for translocations, for example, translocation 1122 in Ewing's sarcoma. Next generation sequencing. It is done to identify targetable mutations like BRAF, EGFR, and ALK. Liquid biopsy. It is used for detecting ctDNA, which is circulating tumor DNA in peripheral blood. This is the future of monitoring minimal residual disease. Now here are Dr. P's exam must-knows. Guardian of genome is P53. Governor of cell cycle is RB gene. Most common pathway of carcinoma spread is lymphatics, and we have seen the exceptions as well. And most common site of hematogenous metastasis is liver and lungs. The Mercedes sign mitosis, it is pathognomic for malignancy. Let's wrap this up. So we have journeyed from the naming of the tumor to the molecular markers that allow it to survive, and finally how we diagnose it in the lab. Remember, pathology is the bridge between basic science and clinical medicine. Master neoplasia and the wards will start making sense. I've created a high-yield PDF cheat sheet of all these tables and flowcharts. The link is in the description. Good luck studying.